Today, I would like to talk about one of the most controversial and misunderstood topics in all of aesthetic breast surgery. We're going to talk about breast implant profiles. So, as you see, there are essentially 6 different types of breast implant profiles. A lot of times patients hear of moderate and high profile, and they think that's all there is. But as you see, there's not 2, there are 6 of them. So what exactly is profile? A profile is basically going to be how tall the implant is relative to its width. So let's think two-dimensionally. Forget about the whole projection thing. So if you think two-dimensionally, an implant is a circle. And if you think that the breast two-dimensionally is also a circle, you want the circle of the breast implant to be just a little bit smaller than the circle of the breast. Why? Because you want it to fill the most amount of the breast as possible without going past the margins of the breast. You never want to put an implant into a patient that is wider than the width of the breast. You want the implant to just be about a centimeter smaller so you get the maximum amount of cleavage, the maximum amount of fullness without going past those borders. So that's why we have all of these different profiles. So a low profile implant is going to be a lot wider and a lot shorter than a high profile implant, which is going to be narrower and taller. A lot of patients come to me and ask me, I'd really like a high profile implant. And I say, why? What are you trying to do? Well, I want it to fill higher up on my chest wall. And that's not the case. The width of the implant is what gives the upper fullness. When we're talking about the profiles, we're talking about projection. Projection is how far the breast implant pushes the breast forward. And that is where the implant profiles come into place. So, who's a good candidate for each type of implant? Well, as you can imagine, there are an infinite amount of shapes and sizes of breasts in the world. So, the wider the breast is, the lower the profile you're going to want. So, who's a good candidate for a low profile implant? A low profile implant is really useful for a patient that perhaps in the past had had a breast reduction. And many times after a breast reduction, you can lose some of that upper fullness. So the breast kind of looks empty on the top and fuller on the bottom. But they don't want a big breast. They were done with big breasts. They had a reduction. They're feeling better. Their back feels better. Their neck feels better. They don't want to go back to having big breasts. But they missed the fullness that they had in the upper part of the breast. That's where the low profile implant really comes into play. It does very well to give the fullness in the upper part of the breast and cleavage definition without giving a lot of projection. Then we have the low profile plus implants. The low profile plus implants I use a lot in patients who I am doing an augmentation mastopexy. That is a breast lift with an implant that really don't want to go too much bigger, but they want a lot more definition in the breast. They want more cleavage definition and more fullness in the upper part of the breast. Then we go to the moderates and the highs. These are probably the most common used implants for primary breast augmentation. Primary breast augmentation means that we're just doing an augmentation, no lift, in a patient who has never had breast implants. So the choice of the moderate versus the high is going to depend on 2 things. One is the patient's anatomy. How wide is the breast? The other is the patient's goals. How big do they want to be? So for instance, standard breast width, it go anywhere from about 11 centimeters to about 14 centimeters. So 11 centimeters would be a narrower breast. So if the patient, say perhaps is an A cup and wants to go up to a B cup, so not too much, I would choose a moderate profile implant because I want it to be wide enough that it fills the entire breast without giving her too much projection to perhaps take her up into a C cup. Now, alternatively, if the same patient with a width of 11 centimeters wants a full C, then I would want a high profile implant because I want, again, the width of the implant to be just slightly narrower than the width of the breast, and this time it's going to give her more projection. Then we go up to what's called ultra high profile. Now, these are not too commonly used. This is more for very thin patients with a very narrow breast who want a very large cup size. So these are difficult to use sometimes because usually those very thin patients with a narrow breast don't have the skin envelope. What is the skin envelope? The skin envelope is how tight the breast is. So usually they have a tight skin envelope which may not stretch. But for instance, if you have a thin patient that has perhaps have had children, or they've already had a smaller breast implant and they're looking to go larger, then the ultra high profile works very well. And then finally here we have the shaped implant. And the shaped implant is another type of profile. So the shaped implant actually maintains the natural fullness of the upper part of the breast. So these are amazing implants for very thin patients that want the most natural result possible. So as you can imagine, by placing in a shaped implant, you can go larger and still maintain that natural fullness of the upper part of the breast, versus a round implant, which is going to have more fullness on top, so it's going to give a slightly more full look. That's why the measurements of the breast are so important. The most important part of the entire surgical procedure with regards to profiles is actually done in the consultation. That's where we take the measurements. So there really is no one size fits all for breast implant profiles. It is the objective measurement of the breast with the subjective desire of cup size that really is what makes us choose the profile that is going to best fit that particular patient. We talk about desired size, and then we do 3D imaging. So 3D imaging allows us to give the patient an accurate representation as to how their breast will look after the surgery. So how's it done? We do a scan, a three-dimensional scan of the breast, and then we're able to actually plug in the different types, sizes, profiles, and shapes of implant, and it gives you a graphic representation of what the result will be. And it's actually very, very accurate for breast augmentation. So by doing those things, we're able to choose the actual perfectly sized, shape, and profile implant for that particular patient. All of these implants are the same size. They're all between about 360 and 380 cc's, but you can see the immense difference in shapes between them. So even though they're the same size, you can see that the low profile implant is more like a pancake, and the ultra high profile implant is more like a ball. And that is the whole definition of profiles. The higher the profile, the narrower the breast is going to be, but the taller. Taller means projection again. Taller is not height on the chest wall, it is projection away from the body. So the lower profile implants are to fill, are to give cleavage definition, are to give upper pole fullness in the upper part of the breast, versus the higher profile implants are to give a larger, more projected breast. So there's no cookie cutter implant surgery, as you can see. There are hundreds and hundreds and hundreds of different size, shapes, and profiles of implants. So it's important to allow your surgeon to guide you through the process, to take your measurements, to understand your goals, and to let you visualize it to make sure that you get the implant that you want. So if you're interested in learning more about breast implants, about the sizes, the shapes, the profiles, and which is going to be best for your breast, shoot a comment down below.